over Hogmanay and New Year's Day, and for at least the first week of January, we are advising everyone to stay at home more than normal, to reduce contacts with people outside our own households, and to limit the size of any indoor social gatherings that do take place so that they don't include people from any more than 3 households. Also try to ventilate indoor spaces as much as possible, and it remains our advice, our strong advice, that lateral flow tests should be taken just before meeting up with anyone from another household. And if that shows a positive result, it is vital to immediately isolate and book a PCR test. You should also isolate and book a PCR test if you have symptoms that might be COVID. Following this advice is difficult and frustrating at the best of times, I know, but it is even harder at this time of year. But it really does help, and it will be helping already, notwithstanding these very high case numbers. So please do stick with it for now. In addition to this general advice to the public, the new protective measures relating to hospitality, public indoor places and live events that I set out last week are now in force. We will review these on an ongoing basis, but at this stage, our expectation is that they will be in force until the 17th of January. That means, for now, limits on the size of live public events, though private life events such as weddings are exempt. For indoor standing events, the limit is 100, for indoor seated events 200, and for outdoor events 500 seated or standing. I know some question the rationale for this, so let me set it out again. Firstly, the higher transmissibility of Omicron means that large gatherings have a much greater potential to become rapid super spreader events. Second, there are transmission risks associated with travel to and from such events. And thirdly, they do place significant demands on emergency services such as the police and the ambulance service. And at a time when emergency services are already dealing with high levels of staff absence due to the virus, not having large-scale public events allows these services to focus on the delivery of core services to the public. As well as limits on large events, further protections are now in force for hospitality and other indoor public places. A requirement for table service has been reintroduced for venues that serve alcohol for consumption on the premises, and guidance has been issued to the effect that indoor hospitality and leisure venues should ensure 1 metre distance between different groups of customers. The one group, whether it is made up of 1, 2 or 3 households, should be physically distanced from other such groups in the same venue. Finally, unfortunately, nightclubs are now closed until 17th January, unless they have decided to remain open without dancing as hospitality premises, in which case they will be required to follow the same rules and guidance as other hospitality venues. All of these protections are important to help us deal with and reduce the impact of the public health challenge that COVID represents. However, they also have a very significant impact on businesses. 2 weeks ago, I announced £100 million to support businesses affected by the advice to minimise contacts over the festive period. We've already detailed the allocation of that. However, last week I announced a further £275 million of support, and I can give some further detail today of how the first £100 million of that additional support is being allocated. £16 million will be made available to support public transport providers through existing COVID support schemes. £27 million will go to the culture sector and a further £17 million to the events sector. A further £32 million will be allocated to hospitality and leisure businesses, with an additional £10 million for those parts of the hospitality industry most severely impacted by the requirement for table service. And up to £5 million will be allocated to nightclubs required to close. We're also working closely with the sports sector. Sporting events are obviously affected by the limit on spectators and also by cancellations due to COVID absences. However, we also know that some of this impact will be alleviated by the rescheduling of events, so we want to make sure that the support we provide is effectively targeted, and we will be confirming further details soon. In total, we have now reached decisions on the allocation of £207 million of the £375 million being made available for business support, and councils are now working to get that money into bank accounts as fast as possible. Decisions on the allocation of the remaining funds will be confirmed following consultation with affected sectors on how it can be best targeted. Presiding Officer, I know how difficult all of this is for business, and I really wish it wasn't necessary, and I hope it's not necessary for long. But there simply isn't an easy trade-off between protecting health and protecting the economy. If COVID continues to spread rapidly, the economic impact in the form of staff absences and diminished consumer confidence will be severe, and we're already seeing those impacts. So doing nothing won't help business. We must protect public health and the economy together by slowing the speed at which COVID is spreading while we complete the booster programme. Presiding Officer, there are two further issues I want to touch on this afternoon. I mentioned earlier the need to mitigate the impact of staff absences on the economy and critical services. Now, obviously, the best way of doing this is by stemming transmission, but we must also ensure that the requirements for isolation are proportionate. I indicated last week that we were weighing the risks and benefits of shortening the isolation period for index cases and also potentially easing the requirement for all household contacts to isolate following a positive case. These are finely balanced judgments, and we are considering the current trends in infection carefully. However, I can confirm that we do hope to reach decisions in the next week with any changes taking effect from the 5th of January, and we will keep Parliament updated. In the meantime, we have introduced a sectoral exemption scheme subject to appropriate protections, and I can confirm today a further change that will help ensure that the exemption scheme, which is dependent on speedy turnaround of PCR tests, is effective. The current surge in cases does mean that testing capacity, sampling and processing capacity is under pressure. So we are now prioritising some slots for essential workers, such as NHS and transport staff, as well as for those who are clinically vulnerable or eligible for new COVID treatments. And this ensures that essential workers will get the test results they need to qualify for an exemption promptly. This is a sensible step to take at this stage. However, notwithstanding this priority for essential workers, let me stress that testing remains available for anyone who needs it. If you try to book a test and can't find a slot in a location you can get to, do try again later. Additional PCR slots are released throughout the day. Test and Protect is also for now focusing its telephone tracing on high-risk settings such as care homes. The majority of us, if we test positive, will be contacted by text or email rather than by phone. So if you are contacted by Test and Protect, either as a positive case or a close contact, please do respond and complete the online form and make sure you follow all advice given. The final point and the vital point, indeed, I want to update on today is the progress of the vaccination programme. Before I do so, though, let me address this point. I've heard people ask in recent days what the purpose of booster vaccination is if we still have to restrict our activities for a period. And I understand that question, but it is the answer that it is vital for all of us to understand. Firstly, getting a booster doesn't mean we won't get COVID, though it will reduce the chances of that. But what it does do is significantly enhance our protection against serious illness. Getting boosted could quite literally save your life. Because it doesn't completely stop us getting or passing on the virus, those not fully vaccinated are still at significant risk. We won't get the full benefit of the booster programme as a country until the maximum number of us are fully vaccinated, which does mean that anyone choosing not to be vaccinated without good reason is acting irresponsibly. But the key point is this: until the programme is completed, and we're getting closer to that every day, we still need to slow down the spread. In recent weeks, there has been a huge increase in booster appointments, and I want to put on record again my thanks to everyone involved in the delivery of the programme and to everyone coming forward to be boosted. 75% of those eligible for a booster or a third dose have now received one. That represents excellent progress, but to deliver maximum benefits, we need maximum numbers to get boosted as quickly as possible. We want to get to, or as close as possible to, the target of having 80% of eligible adults boosted by the bells. And getting there depends on both capacity and demand. Let me make very clear, we definitely have enough capacity now to meet that target. What we need between now and the end of the week is high demand. Eligible people who aren't yet boosted to come forward now and get the jab. High numbers of positive cases are making things more difficult because if you get the virus, you can't get the vaccine for a period afterwards. So cancellation and do not attend rates have been creeping up this week as case numbers have risen. But to everyone out there who isn't yet boosted but could be, please book an appointment now or go to a drop-in clinic. If you have an appointment booked for January, please reschedule it for this week. There are plenty of slots available. Please, please don't delay. Every single booster jab administered now is a step on the road back to normality. And remember, if you haven't had your first or second jab yet, it's never too late for that either. Please make sure you get those now. Presiding Officer, to draw my remarks to a conclusion, it's an understatement to say that the situation we face now is not what any of us want. And I have to be clear that the period immediately ahead will not be an easy one. That said, I do hope that the clearer picture we will have in the next couple of weeks will also prove to be a much more positive picture. And we can all help to make it so. So please do get fully vaccinated. Do it this week. The more of us who are boosted, the less severe the impact of Omicron will be, and the sooner we will all return to normality. Secondly, please test regularly. The advice, if you're meeting other people, is to test before you go every single time. And take your test as close as possible to the time you will be seeing other people. This is really important if you are planning to meet people from other households over Hogmanay, although I would encourage you to please minimise that. And finally, take all of the other precautions which can help make a difference. Work from home whenever possible. Stay at home right now more than normal and reduce your contacts as much as possible, as I said, even over Hogmanay. If you do visit indoor public places, limit the number of households in your group to 3 at most. Wear a face covering on public transport, in shops, and when moving around in hospitality, and make sure the covering covers fully your mouth and nose. Keep windows open if you're meeting indoors and follow all advice on hygiene. Sticking to this is really hard, but it does keep us safer and gives us the ability to slow down spread of the virus as we complete the all-important booster programme. Presiding Officer, this has, and this is another understatement, been another really difficult year. But despite these renewed challenges that we face now, I do firmly believe, largely because of vaccination, that 2022 will be a better year. So let me conclude by thanking everyone again for all of the sacrifices made over this year and by wishing everyone a very happy new year when it comes. Thank you, Presiding Officer.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 55 minutes for questions, and it would be helpful if members who wish to ask a question put R in the chat function now. And I call on Douglas Ross.
Thank you, Presiding Officer. And can I begin by putting on record that I recognise the hardship faced by people across Scotland at this time. Because of the restrictions, we've seen scaled back or cancelled Christmas and New Year celebrations. But there is some good news. The booster programme continues to be rolled out, increasing our protection against the Omicron variant. For anyone who hasn't done so yet, go out and get their booster. Last week, I again asked the First Minister to make changes to self-isolation rules, to allow household contacts to end self-isolation if they have a negative PCR result, and to reduce the isolation period from 10 days to 7 if they test negative twice. However, the First Minister's message today on these essential changes is yet again to tune in next week. We've had the groundbreaking Omicron study that shows while it's more transmissible, it is less severe. So, First Minister, what more information do you need to take the steps on self-isolation that we've been calling for weeks?
First Minister.
Well, this is one of the most important And actually, one of the most difficult decisions we will take in recent days, I know England has already reduced the self-isolation period for index cases. Wales hasn't done it. I don't believe Northern Ireland has done it yet either. And that, I think, illustrates the finely balanced nature of this judgment. And I'll say a bit more about that in a moment. But it is also really important that we understand the context for making that decision. Douglas Ross rightly points to the more positive news in the studies that were published just before Christmas, but as the authors of these studies themselves point out, it is important not to over-interpret these studies or get carried away by the initial data that they provide. While they do suggest that the hospitalisation rate associated with the Omicron is lower than for other variants, perhaps significantly lower, that will not give us any benefit if the overall volume of cases cancels that out and leads us to a higher number of people going into hospital overall. So that is why it is really important that we don't allow the infection numbers to overwhelm us, which brings me back to why the decision on isolation is important to get right, because if we release people from isolation while they may still be infectious, then yes, we will relieve some of the pressure that we're seeing on the economy, and that is not to be underestimated, but that will be short-lived, because the risk we take is that we will actually accelerate the spread of the virus, and then that pressure on the economy will increase in the medium to longer term. So we need to get this right. Why do I say that we are still taking a few more days? Because we have a very rapidly rising number of cases right now, which is both a reason to do this, but also a reason to be cautious about doing it. We have some fluctuation in case numbers inevitably because of the Christmas period. We need to see that settle a little bit over the next few days, and then we need to reach a judgment that is right in terms of weighing the risks and the benefits of this. So we would expect to do that over the next few days, with any changes coming into effect from immediately after the New Year holidays. The final point I would make, Presiding Officer, is that while the focus, because England has already done this, the focus is on reducing isolation for index cases from 10 days to 7 days, it's not the only change that we should be considering. We have a situation right now in the wake of Omicron where we ask all household contacts of positive cases to isolate for 10 days. I hope we can ease that up as well, and I think it makes sense to make sure that we are making changes in a coherent manner. So these things are not easy. I don't underestimate the reasons why there are calls for us to do this. I hope we will do this, but I don't think anybody looking, particularly at the case numbers that are being reported today, would fail to see why it is important that we take a very responsible approach to this and make sure that, as far as it is possible to do with any aspect of handling this virus, we're getting it as right as we possibly can. And I'll keep Parliament updated over the next few days around the detail of any changes that we do decide on and propose.
Douglas Ross.
Businesses across Scotland are struggling with the impact of these restrictions at what should be their busiest time of the year. And many of the same businesses are also affected by these self-isolation rules. Absences and a lack of staff cover will mean premises having to close early or not open at all, despite staff members testing negative. I've been speaking to businesses throughout the festive period, and they're trying to plan for the next few weeks and months. But the First Minister's indecision on these self-isolation rules is continuing to cause them trouble to plan for the period ahead. What's also causing them trouble is a lack of financial support. Weeks ago, I asked the First Minister and the Chamber to get this financial package to businesses before Christmas, and she promised to do everything possible to deliver that. Given so many businesses are in dire straits and need of financial assistance now, can I ask the First Minister why they're still waiting for the money to come through?
First Minister.
Well, what Douglas Ross describes as indecision is actually responsibility, and that's the most important burden on my shoulders, is to be as responsible and as measured in taking these decisions as possible. I know that businesses are struggling, critical services are struggling with staff absences. If case numbers continue to rise, that will become more difficult, which is why we need to try to slow down the increase in cases, because it is the virus, not self-isolation, that is the cause of this problem. But the self-isolation rules need to be proportionate so that they are not exacerbating that problem. So I don't argue in any way with the central premise of the question here, but there is an element of common sense that needs to be applied as well, and that's where careful judgment comes into play, because if we ease up on the self-isolation rules too quickly and we don't take sufficient care, then even although we're doing that for good reasons, all we will do is increase the overall numbers of infections, because we will contribute to the spread, and therefore the problem that businesses are suffering won't get better, it will actually get worse. So these are not easy judgments to arrive at. Governments elsewhere are struggling with this as well. I recognise the importance of speed, but I hope others will recognise the importance of being measured and responsible in this as well. Dealing with this virus, and I think we've all learned this over the past couple of years, every action has a reaction. Every decision you make has a potential consequence, sometimes an adverse consequence. So that calls for careful decision making, which is what we've tried to do throughout this. And as I say, we will reach a decision on this over the next few days, with any changes coming into effect after the New Year period from the 5th of January. But we're not doing nothing in the meantime. The sectoral exemption scheme is important and is already helping in many key sectors, and the changes that I've talked about today to ensure prioritisation for essential workers in access to testing will also help further. So there is no sense in which we are not taking this issue seriously, but we're simply trying to avoid compounding a problem as we try to solve that problem. Secondly, on financial support, Presiding Officer, the financial support available for businesses in Scotland right now is significantly higher proportionately than it is certainly in England. I can't speak so much for Wales and Northern Ireland. That demonstrates the seriousness with which we're taking this, and money is flowing and will flow to businesses as quickly as possible. From announcing it, through to making the money available to councils, through to, I think, just days before Christmas, COSLA leaders meeting to agree that they would disperse these funds, to the checks that are being done right now to get the money out of the door. It is being done at pace, and money will start flowing to businesses in the days to come. And of course, there will be more of it as we allocate the additional funds that we have made available.
Douglas Ross.
So the First Minister has just confirmed that the money didn't get to these businesses before Christmas, and that is unfortunate because they are really struggling now. But the First Minister also mentioned access to testing. And today we've seen widespread reports of a lack of availability of testing across Scotland. And over the last few days, we've heard of results taking up to 4 days to come through. This undermines confidence in our testing system, particularly when people are having to isolate over the festive period. Now, I realise this is a UK-wide, indeed a global issue, but can I ask, what are the Scottish Government doing to ensure that people can get tested and are confident that they'll get their results quickly?
First Minister.
Well, firstly, this is a UK-wide system, and I don't say that to in any way pass responsibility. We are working closely with the UK Government to make sure that the flow of testing remains as we need it to be. There were steps taken to constrain demand in England last night, which I understand mean there are no bookings available today for physical test sites in England. While that change was being made last night, there was an administrative error made that restricted slots in the other 3 nations. That has now been rectified, and I went on to the system myself just about half an hour before coming to make my statement, and actually Scotland and Wales were the only parts of the UK where there was availability of PCR tests at physical sites. Now, we monitor that on an ongoing basis. There is work being done to make sure that testing capacity continues to increase, but also the prioritisation for that testing capacity is also being given due regards, and I covered some of that in my statement. There have been lengthening turnaround times. We hope they will return to normal over the course of the next couple of days. There will continue to be pressure on tests, but it is important that the system continues to flex and respond, and I've got confidence that that will be the case, and we'll continue to liaise closely with the UK Government about that. One final point to make, and I think this perhaps is a factor in some of the constrained constraints put on demand in England over the last few hours, is that the testing system, like other parts of the economy and critical services, will be suffering from absence rates because of COVID, which of course comes back to the earlier points about the need to take decisions, albeit careful decisions, around things like self-isolation. These are all interlinked matters, and that's why we continue to keep all of them under close review.
Call Anna Sarwar.
Thank you, Presiding Officer. I'd like to offer my deepest sympathies to those that have lost a loved one, especially at this time of year. And I also want to pay tribute to Scotland's vaccinators. They continue to go above and beyond. And over the Christmas period, all our frontline workers have worked tirelessly to keep us all safe and secure. So thank you to each and every one of them, and of course their families. I can also thank all those that have come forward during the holidays to get their boosters, and to repeat a plea. If you haven't yet received your first dose or your second dose or a booster dose, please book an appointment or visit a drop-in centre today. I know what the First Minister says on isolation periods and a decision on the 5th of January, but actually staff absences are spiking now, and that's having knock-on effects on our services and indeed on industry. So can the First Minister share the scientific evidence she is relying on when asking people who have tested negative to remain in isolation for 10 days? I note, for example, there are some countries that are looking to reduce it to 5 days. That was announced just today. Every restriction has a knock-on effect for workers and businesses, particularly in hospitality and retail. So can I repeat calls for the UK Government to work with devolved governments to support workers at this time of crisis? Many are literally fighting for survival. And industries associated with hospitality, events and retail also appear to have fallen through the cracks. What action is the Scottish Government taking to ensure that all those that are eligible for support are actually receiving it? And what plans are in place now to widen support to those affected businesses, for example, the taxi trade, who have seen their income collapse but are not currently eligible for extra help?
First Minister.
Thanks for that. On the issue of staff absences, I've already recognised, and I do recognise the burden this is placing on businesses, but also on many services across the country, which is why it's important that we do make the self-isolation rules more proportionate if we can. The science that Anna Sarwar asked me to give, it's all to do with the incubation period. We know that people can become infectious and test positive for the virus after a period of 7 days. In fact, if we cast our minds back to the earlier part of the pandemic, the isolation period, it wasn't 10 days as it is now, it used to be 14 days, so it already has been shortened, which already has introduced greater risk into this. If we're going to do that further for good reasons, we have to be aware that we increase that risk. And if we get that wrong, if we increase the risk too much, then any benefit from that will be outweighed by faster spread of the virus, which will not solve the problem for businesses. It will compound the absence problem for businesses. So I'm not disagreeing with anybody who's saying this is an important decision, but I would ask for an understanding of why it is important to get this right. It's also correct to say that different countries are coming to different conclusions here. The Centre for Disease Control in the United States, it has, as I understand it, and I may be not getting this entirely right, but reading some of this morning, as I understand it, this is for asymptomatic cases, only has reduced the isolation period to 5 days. So again, there is some difference of opinion about the appropriate degree of risk. All of that says we need to weigh these things carefully, because if we don't do that, then any benefits that we might get in the immediate term will be outweighed by the increased risks in the longer term. In terms of business support, I continue to hope that the UK Government increases the level of support they're making available to business so that we are able to do likewise, although proportionately we are already delivering significantly higher business support. As I said in my statement, we have made decisions and confirmed announcements on allocation of 207 million of the 375 million that we've made available. The remainder of that we are consulting with different sectors. Can I say that will include considering support for the taxi sector. We have previously provided support for the taxi sector, but we know they are one part of the economy that suffers considerably from fewer people going out and socialising. So they are very much in our minds as we reach decisions on the allocation of the remainder of that money, and we'll set out those decisions as soon as possible.
Anna Sarwar.
Thank you, President Officer. And I welcome those comments, particularly in relation to the taxi trade, and look forward to seeing the details of that additional support. The First Minister referenced testing in her statement, and also in response to previous questions. We know that testing is the key to breaking transmission and reducing transmission as well, from lateral flow tests for visiting friends and family to the PCR tests, which determine the spread and pace of the virus. It's core to our response. And I note what the First Minister said around looking 30 minutes before she came on, but I have had constituents be in touch, and indeed people across Scotland this morning not being able to access tests, and also struggling to access lateral flow test devices too. So issues around delivery online, and even people being asked to travel to different parts of the country or having to wait as long as 72 hours to get the results. So can I ask the First Minister to consider the disruption this is having on frontline workers, the disruption it's having on services, on businesses, and literally putting livelihoods on the line. So what action has been taken to increase capacity of testing, to increase the availability of testing, and also the speed of results as we approach Hogmanay? Testing is the way to get us through this crisis.
First Minister.
Testing is one of the ways to get us through this crisis. It's a really important way, but I wouldn't want to give the impression it's the only way. Getting vaccinated is also really important, and following the advice to slow transmission is also vital at the moment. As I said in response to a previous question, as demand was constrained for England last night, an administrative error led to slots also being removed for the other 3 nations. That has been resolved. There will be fluctuations in availability. There will sometimes be slots available in places that are not easily accessible, which is why what I would say to people is go back and check later, because new slots are made available for PCR tests throughout the day. The work of ensuring that there is adequate supply of testing, both the sampling capacity, which is the local test sites, the mobile testing units where the tests are taken, through to the laboratory processing capacity, that all of that is fit for purpose. Because we know that for some people getting speedy access to test results is even more important than it is for everybody, and it's important for everybody. That's why we are also within the availability, the available capacity. We're making sure there is a priority given to essential workers, those who are most clinically vulnerable, and also to those who are now eligible for some of the new treatments for COVID. So these are ongoing issues of priority work for the Scottish Government, but this is a UK system, so we're required to ensure that that is done in partnership with the UK Government and the other nations. What I would say to people is there is testing capacity there, so please, if you have a positive LFD, or if you have symptoms, or if you're advised to get a test, please make sure you book it. There is also a supply of LFD tests, either from test sites or pharmacies, or by ordering online, so please make sure you make full use of that.
Alex Cole-Hamilton.
Thank you, Presiding Officer. Presiding Officer, 8 days ago, I asked the First Minister to set out our national capacity for PCR testing and how that would be expanded to deal with a surge in demand. As we've heard already today, we've seen numerous reports of delays across Scotland. At this time, MSPs are still in the dark about the reach of our capacity. So can I remind the First Minister of her commitment to me to update Parliament on this matter through the Scottish Parliament Information Centre? Presiding Officer, last week I met with the hospitality sector. They told me that the money on offer from the Scottish Government at the moment represents just 1/8 of their January pay bill. It will barely last them 3 days. Today's 16,000 cases will leave them in serious doubt that they'll be allowed to reopen on the 17th of January. Many businesses are on the verge of making irreversible decisions, and people are losing their jobs. So can I ask the First Minister, if her government choose to extend restrictions beyond the 17th, what reassurance can she offer that further support will be made available to a hospitality sector already on its knees?
First Minister.
Firstly, I'll make sure information on capacity and the changing nature and volume of capacity is placed in SPICE, but I would as I think I said when this question was posed to me before, remind people that capacity right now is not a fixed thing. There are efforts ongoing all the time to maximise capacity on a daily basis and indeed to increase capacity, and therefore it's important that it's not seen as something that is fixed and unchanging. We do know capacity is under pressure. I think yesterday or the day before we reached demand took up about 85% of available capacity, which is getting to a level where we will start to see lengthening turnaround time. So this is ongoing work that we do to make sure that these issues are being resolved on a daily basis. On the issue of business support, we are making business support available to the maximum of our financial wherewithal. The £375 million that we have already confirmed, I would say two things. Firstly, proportionately, it is way beyond what has been made available by the UK Government for England, even although businesses there are facing the same pressures, or many of the same pressures. But secondly, I know it's not enough, I've said that all along, but we do not hold in Scotland the borrowing powers to extend financial support any further. And the way the Barnett formula works is we only get a flow of resource when the UK Government takes decisions for England, which, as is their right, they are not choosing to do at the moment. So we need to see a response from the UK Government that will allow us to increase that support further. In the meantime, we are providing support as far as we are able to do. I don't think it's helpful to speculate beyond the 17th of January at this point. I very much hope, and it is our intention, that these protections are in place only until the 17th of January, but as has been the case since day one of this pandemic, we have to keep the situation under review. What I said in my statement, I think, is worth repeating, that because, yes, we've got a rapidly rising number of cases right now, but we know that we need to judge the impact of that through monitoring very carefully the health and NHS impact. I think we will have a much clearer picture over the next week or two that will then allow us to make informed judgments about how we deal with this in as proportionate a way as it's possible to do.
Emma Harper, to be followed by Sandesh Gulhani.
Thank you, Presiding Officer. Given the December 23rd announcement by WHO that the virus can spread through short and long-range aerosol or short and long-range airborne transmission, could I ask the First Minister what ongoing assessment is being made regarding the implementation of FFP2 and FFP face masks frontline healthcare workers as a first-line prevention measure against acquiring COVID, which is already causing high sickness and absence among healthcare workers in Scotland? And I remind colleagues that I am part of NHS D&G's vaccination team.
First Minister.
Thank you. We have reviewed the WHO recommendations from last week and noted that the WHO has not changed its position on the route of transmission of COVID. We're therefore satisfied at this stage that these areas are covered within the winter respiratory guidance that was published in November, at the end of November. That guidance provides staff with the opportunity to risk assess what level of PPE is required, so it already allows for healthcare workers to wear FFP3 masks or masks of similar standards in settings where care is provided to patients with suspected or confirmed COVID. The Health and Safety Executive is frequently consulted and supports the guidance in place, and we will continue to review all of the international evidence and advise on any required changes through the COVID nosocomial review group.
Sandesh Gulhani, to be followed by Jackie Bailey.
Thank you, Presiding Officer. We know the dangers posed by Omicron and the balance that needs to be struck, but people struggle with the inconsistencies. Rangers fans were saying Asda was busier than Ibrox, and Celtic fans were also distraught, knowing that shopping streets and malls across the country were heaving and comparable to football stadia. My question is, does the First Minister understand the value the societal role of Scottish football plays in the mental health of hundreds of thousands of people in our communities? And will the government provide additional support to protect the mental health of fans?
First Minister.
Yes, I do understand the importance of sport, football and indeed other spectator sport. I think the benefits of that are seen in terms of mental health and in a whole host of other ways. So nobody, including me, takes the decisions that we've had to take over the course of this pandemic lightly. I've tried to set out the rationale for limiting large-scale events. It is about the super spreading nature of big events, given the higher transmissibility of Omicron, but also the greater impact that these events have on emergency services that are already stretched, and some of the risks associated with travel to and from events. So it's not easy. Nobody wants to be in this position, but these are the reasons why the Scottish Government, in common with many other governments, have taken these decisions, and hopefully they will not last for very long. There is always the ability to point to inconsistency. I'm never sure when questions like that are posed to me whether the argument is that we should not have restrictions in football or we should also have restrictions on shopping malls. We want to limit and minimise the protections that are in place, and therefore the restrictions on people's lives. But I would ask people to remember that our core, the bedrock of the advice that we're giving right now, is to stay at home as much as you can, certainly more than would normally be the case at this time of year, to try to limit your contacts with people in other households and keep those contacts where they are happening as small as possible. So that applies regardless of the setting. There is no magic wand to wave to get ourselves out of that. The closest we've got to that is vaccination, which is why that remains so important. But while we navigate this latest wave of infection, given the greater transmissibility, all of us accepting that some of these things are just inescapable at the moment, acting in line with the guidance will get us through these things more quickly than will otherwise be the case. But I, of course, understand, and as a citizen, experience these restrictions just like others do. So none of us want these to be in place for any longer than is necessary.
Jackie Baillie, to be followed by Neil Gray.
Thank you, Presiding Officer. We know that antiviral medication reduces the risk of people becoming severely ill with COVID. For the 180,000 people currently shielding in Scotland and for their families, this is very welcome indeed. But I understand that the eligibility criteria for getting the medication was decided by the 4 chief medical officers, and it doesn't cover all those currently shielding and misses out key vulnerable groups. Will the First Minister urgently review the criteria so that no one who is shielding is left out? And will she also ensure that the process is streamlined? Because having to access a PCR test and then wait for Test and Protect phone when case numbers are rising can lose valuable time. Indeed, for some, they were contacted beyond the 5-day window, too late to get the medication. And I'm sure she will agree that we need to act quicker.
First Minister.
I do, which is why I'll come back to one of the points I made in my statement that I'm sure Jackie Baillie heard clearly. I'm not sure if Jackie Baillie is suggesting that I, as a politician with no clinical qualifications, should somehow substitute my judgment on eligibility for that of the 4 chief medical officers. I do think it is right that on issues of eligibility for antiviral treatment, particularly at this stage, that these are questions for clinicians and for our clinical advisors. Of course, we will want to see the numbers and the range of people who access antiviral treatment expand as treatments continue to expand and as our access to and the availability of these treatments continues to increase. But I do think, genuinely believe that these are decisions that are best informed by clinical advisors, not by politicians, and I'll continue to listen carefully to what they say. The point about the speed of access to PCR tests is an important one. I know I went through a lot of information in my statement, so genuinely I know it might have been easy to pick up on this, but the prioritisation I spoke about within the PCR testing system for essential workers, I also said that we were making slots available as a priority for those clinically vulnerable and for those who are eligible for the new antiviral treatments, to make sure that they are getting these test results timelessly in order then to not lose out on access to treatment. So that's one of the important changes that I covered in the statement earlier.